Okay, good afternoon, everybody. My name is Ai Lang. First of all, let me ask you a question. Let's say there is a kind of doctor who can only cure one type of animal. How do you call them? What do you call them? Right? So, 1, 2, 3. Okay. Do you have answer? Let me tell you the answer. That is human doctor. Okay? And how about vet? You see, vet is the animal doctor, right? And the vet can cure so many animals. But human doctor can only cure one animal, which is human. You see the difference? Okay, this is kind of joke, but this joke tells us something. It tells us the difference between a vet and a doctor, right? So last 2 months, I was thinking about studying vet because I'm studying the LLB now under the international program of the UOL, right? So I'm thinking, what am I going to study next, right? I always wanted to study, and in last 2 months I was thinking about vet, so today I'm going to explain why I wanted to study vet, right? But at the end, I want to tell you, at the end, I gave up this plan, right? Okay, but it is also interesting to tell you why. Okay, because I always wanted to learn the human body. I believe everybody will get old and also get sick. When you are old. In Chinese we say 生老病死. So you get, how to say, get born, get birthed, right? And then you get old, and then you get sick, and then you die, right? So these are the 4 processes everybody has to go through, right? But if we know knowledge, okay, especially if we know deep knowledge about the human body, the medicine's knowledge, the pharmacy knowledge, right? Maybe you can first make your life longer. You can live longer, right? Maybe you can live more comfortably, right? Because the knowledge of medicine, the knowledge of the health, your body health. Maybe you can make yourself more comfortable by taking some medicines, right? Like painkillers. And it's kind of important knowledge, because certain medicines is bad for you. Certain medicines might not have any effect on you, right? Might not damage your kidney. So to make yourself comfortable, right? You kill the pain, and you don't leave any side effect. That is the purpose that we want, right? So if you know the knowledge, you might be able to do better than other people, right? And live more comfortably. So this is why I always wanted to learn the knowledge about body, the knowledge about medicine, right? So that is why I always thinking about learning some subjects, some course which is health related. Last time I remember I researched about a course which is called if I'm not mistaken, it's called biomedical science, something like this, right? Because from my understanding, the biomedical science is about everything that the doctor will learn in the med school, right? In the university, in their medicine course. So it is all about theory for the biomedical science, and it is all about the medicine without the practical, things like operations on the body, like practicals in the hospital. No such thing. All are theories. So from what I have known about this course, all the theory, all the knowledge that will be learned by a doctor will be learned by the students of biomedical science also. So that's why last time I researched about this course, and recently I researched about the vet. I think vet is a good course for me, for my purpose, because vet carries less responsibility. You imagine if you do some operation on the dog, and then because of your is that called miscarriages, because of your mistake, okay, your mistake, because of your mistake as a vet, the dog dies, okay, what will happen? First, you might be able to argue it is not your fault, correct? If you failed to do that, then what do you need to do next? You pay the damage. I mean, you compensate the owner, right? Maybe a few thousands. Yeah. So that's all. But for a human doctor, if because of your mistake and the patient dies, you might be catched by the police. I mean, you might be locked up by the police. You might be sent to jail. Okay, sent to the prison for maybe 3 years, maybe 5 years. I'm not sure. It depends on the fault. Depends on the law of your country. Correct. So what I want to say is that the responsibility of a vet in this respect is less, right? And because of this, I think it gives me at least the benefit of learning. You see, because of this less responsibility, there is more chance for you as a vet to carry out operation on the body. Any kind of body, animal's body, human's body. No, you cannot, as a vet, you cannot do operations on human body, but you do operations on the animal bodies, right? This will give you experience, right? At the end, I want to know myself, the body of myself more, correct? And I think I need some hands-on experience. If I study biomedical science, you don't have a hands-on experience, right? But if you are a vet, you will have a lot of hands-on experience, because you will have more chance of doing operation on animals compared to human doctors, right? Most of the human doctors, I think 90% of the human doctors that we have seen in the clinics, in the hospital, are those doctors who don't often do operations. I know they did learn operations when they were in the university, right? But when they are in practice, most of the doctors actually don't do the operations. Dentists will do more operations than doctors, will do more surgery than doctors. And that's why I once heard from a dentist saying that to be a dentist, you need to be good on hands-on work. You need to be good in controlling your hands, in doing handcrafts, because it requires you to be good in surgery, to be a dentist, right? But to be a doctor, most of the time you will just be you will not do operations. You will do operations when you are a specialist, right? And so that is not good for me, because I want to do operation and I want to know the organs, the working, the mechanisms inside the body. especially inside here, right? So I think being a vet will give you such opportunity, right? And what else? So let's say I were how to say grammatically correct. Let's say I were a vet. Okay, let's say I were a vet. And one more thing, this is only for me because I don't like to work for other people, right? And I want to be my own boss. I want to be my own teacher. You see, when I study for law, I don't go to college. I study myself at home, right? And I take exams. So this is the same thing for vet. I don't think I would like to learn from other people when I'm in practice. Of course, you need to go through the university stage. You have to learn from the university lecturers, the professors, right? But after that, I would rather prefer to learn myself when I'm in practice, when I have like the ability to conduct things for myself. I want to do things for myself, right? So let's say I were a vet, I will open a clinic, the vet clinic, right? And then I can, by doing this, by having those equipments, right, for operation, I can help those stray dogs, stray cats on the streets. When I sense something's wrong, when I see, when I'm confident that they are like, sick, they are like something wrong in their bodies, I may be able to help them. And from there, I do some, maybe it requires, the conditions require me to do operations. I may be able to do the operation, and from there I can gain experience. I'm not sure whether this is legal or not. If this is not legal, please comment and tell me this is not legal, and I will not do that. So, but what I mean is, by helping, for free, helping the stray dogs and stray cats, you can gain experience from there. And let's say you have already done a lot of operations on stray dogs, stray cats. I think for me, I will be like having more confidence, and let's say until a stage that I think I'm confident to operate for my customers, for my clients. Then maybe I can like focus on this surgery, animal surgeries, and from there I can gain experience, and then I know, mammals are quite the same. I know there are some difference, like from what I heard, a cow don't have a pancreas, correct or not, or don't have a certain kind of organs that we human have, correct? I'm not sure whether it's pancreas or not, but I think it is pancreas, right? So despite of this small difference, I think most of the organs, most of the mechanisms are quite the same, right? So if I have a chance to study vet, I will be like, I will have the medicine's knowledge, right? And from there, I think I can learn myself for the human's medicines, human body. I can learn by reading more books, and then this vet career can give me hands-on experience. And by reading more books, I can have more theory, learn more theory about the human body, then I can take care of myself, take care of my families better. I know what are their problems, and which doctor that I should send them to, Yeah, that's why I want to be a vet. I wanted to be a vet, This is all the reason, right? But at the end, I gave up. Because at first I didn't know to be a vet, it requires you 5 years. It requires 5 years of university studies. 5 years of university education. I didn't know that. And you still need like practical, like the housemanship for human doctors, something like that, you know. That is, I think this cost me too much, too much of my freedom and time. If I don't think I'm able to commit like 5 years of free time to a university course. And what I heard is this is quite like intensive, right? It is nothing. I mean, this is not easier than the human medicine, right? They are like quite the difficulty are quite the same, right? And back to our joke. You see, vet, there is one more benefit, like that they are good at certain things that the human doctor is weak at, you know. Vet need to cure for so many animals, right? They can like cure the cows, the chickens, you know, the pigs, the monkeys, you know. So they are like, their skills is transferable between different animals, and they are like trained to like trained to be like, how to say, trained to be like flexible, right? They don't think they are just treating one kind of animal. The knowledge for one kind of animal sometimes can be like how to say it, can be like used on other animals, and you know, they will adjust it. They will adjust to their existing knowledge to other animals. You know, they are like flexible. They are like, they don't like reject. They don't reject, right? And before they really, you know, take care of another kind of animals, they have the preparations that this animal is different. You know, they are prepared to learn new things. They are prepared to be flexible. This is, I don't think the human doctor is good in this, right? Because human doctor only treat one kind of animal, which is human, right? This is what the vet do better than the human doctor, right? I'm not really the expert in these two fields. I'm just beginners. Like, I don't consider myself as beginner because I haven't started learning these two courses yet, but I did some preliminary research on these two courses. So my information, my knowledge about these two have a high chance to be wrong, right? So you don't take this as any medical advice, any legal advice, you know. If you think what I said today is wrong, then please comment and clarify my mistake and teach me, okay? Teach me. I will learn from you. That's all for today. This is what I want to share. Yeah, because I have done like online research about these two courses, and I don't want to waste the information that I have gained. So I think it's good to like tell you guys what I have gained from my online research. Okay, that's all for today, and I hope next episode I will talk about can the pharmacists make drugs? Because I've watched the Breaking Bad. You know, Breaking Bad, the main character, Mr. White. You know, Mr. White is a chemist. So I think why don't the director make this main role as a pharmacist? Because pharmacist is a specialist for drugs, right? Why they put the main they set the main character as a chemist rather than a pharmacist. Okay, in next episode I hope I can explain this. And so next episode will be very interesting. Stay tuned, okay?